Hi guys, it's Dr. Qureshi and today's topic is tamoxifen and the side effects in the eyes. So sometimes I get patients who are obviously females who are using tamoxifen for their breast cancer treatment, and they are mostly referred by their oncologists to come see us, to their eye doctors or eye specialists, so that we can determine if there are some side effects that are happening in their eyes. So I'm going to talk about four main things that can happen. The first thing, with prolonged use of tamoxifen, you can have blurry vision. So sometimes the vision is not perfectly corrected to 20/20. The second thing is to check their retina, which is a very important area because that can affect that can be affected with the use of tamoxifen. You can see retinal deposits and also macular edema. So those are the two things that can absolutely affect the vision. The third thing to check is the cornea. There's a classic pattern that you can see on the cornea, which is known as whorl keratopathy. If that happens, then the vision can be affected also. And the final thing is to check their lens to see if they have cataract development. So those are the four important things that you should remember as a doctor, as an eye doctor or eye specialist, to check in patients who are using tamoxifen for breast cancer. So just to recap, check the vision to see if there's any blurriness. The patient that I saw today in particular did not have any blurriness with and without correction. The second thing to remember is the retina, to check for retinal deposits and macular edema. If the macular edema is present, absolutely vision is going to be decreased and blurry. Third thing is to check the cornea to see if there's any whorl keratopathy, a particular pattern that is present on the cornea that you can check on the slit lamp exam. And the final thing is to check for cataract. Again, my patient did not have cataract, and all these things can be done in the exam room in a dilated fundus exam. Oh, and one more thing to remember is to definitely dilate the patients. If you don't dilate, you won't be able to check the retina thoroughly and definitely not see the macula in detail. So dilated fundus exam is going to help you see things as a doctor and also educate the patient. So when they're sitting in the exam room, you can show them the picture and then talk and discuss about the findings with them. So remember tamoxifen usage and side effects in the eyes. Thank you. Have a good one. Bye.